Hey everybody, welcome back to theclinicaltrialsguru.com. Again, it's theclinicaltrialsguru.com. If you're on YouTube, subscribe. I need more subscribers. Please subscribe. If you're on the blog, also subscribe. I like to give stuff out all the time. Holiday seasons are coming up. I want to give you guys a whole bunch of stuff, a whole bunch of value. And I'm talking about real prizes, okay? Eventually we'll have really good prizes. I'm talking about iPads and stuff. But for right now, smaller stuff like books, and I'm not talking about just my books, just books in general, other cool things like that. But eventually, you want to be on that email list because my prizes are going to get better. I want to do something like Oprah did, where she gave a car to somebody in the audience. Eventually, not yet. I do want to buy the Clippers. Anyways, to keep with my theme of follow-up that everyone liked so much, I was referring to research clinics that are trying to get more studies that need to follow up with the study sponsors. I was also referring to research clinics that need to follow up when they're trying to recruit study participants. Now, this video will be for the research site directors and the study coordinators. If you're a research site director, you need to follow up with your study coordinators. You can't assume that just because you think something is important and you know it's important, that your study coordinator is going to know it's important. This is especially true if that's a new study coordinator, but it's not just for new study coordinators. It's for any kind of study coordinator, new, intermediate, experienced, advanced, expert, guru. Doesn't matter. If you know as a site manager that something's important, even if you tell your study coordinator one time, hey, this is important, I need it done, if you don't follow up, they're going to assume it's not important or they'll forget about it, because we're human beings and we're programmed, we're conditioned to respond to directions. So if someone follows up with you on something, you're more likely to respond. So if you're not following up with a study coordinator on a particular topic, they may not give any action. An example of this is one of my clients that I consult for. They were a new clinic. They had a new coordinator. The site director gave the study coordinator their task of filling out a CLIA waiver. So for all of you guys working in the industry, you know CLIA waivers are important. Sponsors will ask for it. The site manager told the study coordinator, hey, fill out this waiver. It's important. Any questions, let me know. Months later, the sponsor asked for the CLIA waiver, and the site manager asks the research coordinator, did we get the CLIA waiver back in? The study coordinator said, oh, I had some questions on that CLIA waiver, and since no one followed up with me, I didn't think it was important, so it's in my box. It's on my to-do list. This is no good. You can see how both parties are guilty of not following up, although the biggest blame goes to the site director because they're experienced and they need to follow up and train their study coordinators, especially the new study coordinators, on what's important. You could see in this example, clearly illustrated, the study coordinator was told something was important, but the sheer fact that there was no follow-up, the study coordinator put it off on the back burner because they got busy with other things. And this is not a lazy study coordinator. This is a study coordinator that's doing a lot of things. And he just saw that, hey, I have other things that I think are more important right now, so I'm going to do those. As it turns out, this was one of the most important things he could have been working on. And because there was no follow-up, nothing was going on. Now, vice versa, for you study coordinators out there, it's important to follow up with your site directors or your managers just to cover your own ass, so you don't get in trouble or written up or laid off or fired. If you know you have something on your to-do list and it's been there for a long time, or you see it somewhere in your file of things that you still have to accomplish, ask your site director. Tell them, hey, I know you gave me this thing. I've had other things I've been working on. Is this important for me to take care of right now, or can it wait a week, a month? How long can I wait? You need to follow up. So both parties need to follow up. Hopefully this helps. And just as a quick side note, that follow-up video was so popular that a site that I'm working with that wants to open a new clinic and they want to partner with me, they actually are considering calling the site Follow-Up Clinical Trials. I don't think that's the name they're going to choose, but this is a true story. Follow-Up Clinical Trials. So if someone wants it, it's out there. It's probably available. Just thought that was funny. Anyways, keep your questions coming in and keep watching. And remember, Follow-Up Clinical Trials, you guys. All right? Thank you very much. Dan from theclinicaltrialsguru.com. Take care.